My name is Michael Dabbah. I'm one of the orthopedic spine surgeons here at the Spine Institute at St. Joe's. The XLIF, or the Extreme Lateral Interbody Fusion, is a minimally invasive spine procedure. It's been developed approximately about 20 or 25 years ago, and it's gradually gotten more mainstay. It's a surgery that we perform through the side of the body, which is more innovative and obviously less invasive. XLIF is usually used through a variety of different conditions. It can be treated for individuals that have spinal stenosis, that have spinal instability, that have scoliosis, that have degenerative disc disease. It pretty much captures a broad array of different spinal issues. So the XLIF differs from traditional surgery in multiple different ways, but the main difference is that the XLIF, since it gets to the spine through the side of the body, it preserves the lumbar musculature, the lumbar muscles, and the bone. So unlike traditional surgery where you have this big incision in either your front of your spine and your belly, or your big incision in the lower back part, and the muscles pretty much get dissected out and you remove bone, none of that occurs during the XLIF. So we do not injure the muscle, we don't injure the bone, and we preserve both the muscle, bone, and ligament, which is quite different from the traditional way of doing it. So the XLIF is performed through the side of the body. It's a small incision of probably about 3 to 4 centimeters in length. We go down through the use of X-ray and neuromonitoring to monitor the nerves, come onto the disc, and we remove the disc that is positioned between the two vertebrae. Once we remove the disc, we insert a cage that separates the vertebrae. The separation of the vertebrae and the restoration of the height of the disc indirectly makes more room for the nerves, relieving any sciatic or nerve type pain. There's multiple advantages to the XLIF. It includes less blood loss, less surgical time, less pain. As far as hospital stay goes, I've had individuals leave the same day, but on average, it's usually a 23-hour stay. So it's usually about 6 weeks before you can start doing your normal daily activities, such as bending, lifting, twisting. And most people are able to get back to a normal job at about 8 weeks. So athletes or individuals that are in construction that require high labor, it may take them a little bit longer to get back into that. Into their job, just because of the strenuous activity that it requires. So here at St. Joe's at the Spine Institute, we do a large number of spine surgeries. We've been doing the XLIF for approximately about 15 to 20 years. The average number of XLIFs that are done here is probably the highest within the state. So overall, you're in good hands here at St. Joe's having the XLIF procedure done. So spine surgery is unique in orthopedics. I was drawn to orthopedics because orthopedics is usually very simple, meaning you break something, we fix it, and an individual gets better, and they're feeling, and they're very happy with what you've done. And spine surgery is very similar in that way, meaning you have a pinched nerve, we free the nerve up, and 9 out of 10 times, the individual is happy that we did it. So nerve pain, unlike bone pain, is probably a lot more debilitating, and the appreciation an individual has for when you relieve that pain is pretty significant, and that's what drew me to spine.